Thank you. I'm from CGTN, China Global Television Network. So my question is, it has been 2 months since the coronavirus was first reported in China, and we know that since then, a lot of measures have been taken by the government to contain its spread across the country. Now, looking back, what kind of lessons can we draw from this fight against the disease? Thank you.
Okay. Thank you for the question. Actually, in my opinion, it's very important things is 2 key points. One is for the mobilizing all resources, and second is the diagnosis, control the disease scientifically. In terms of mobilizing the all resources, actually not only the medical person, doctor, nurse, but also the social worker and the logistic staff, and especially for the construction workers so on, all is important, like establish the mobile cabin hospital. It's really amazing because can treat more mild patient. Because most of our patients is mild and need to isolate it and observe the changing condition. If change from mild to severe, can transfer to our side, because our task is treatment for the severe patients. And we are happy for the training and discharging some patients back to home and back to health. And some severe patients become mild, but also some pass away, because we need time to realize the mechanism of this virus infection. And also we already established the different treatment, like the oxygen giving and use non-invasive invasive Valentine something, and also try to use some drugs and other treatment, but we need time to survey for that. So we organize the specialists together and even the remote consultant for improve the treatment result. So it's, we need scientific control of the disease. And thank you.
Okay, Professor So.
Okay, thank you. I think it's a good question, yes. In no more than 2 months, the disease, because COVID-19 is not only a Wuhan disease, and it's not only a China disease, but it's also a global disease. So, so the question is what lessons? But I want to say that what achievement the China doctors and the China scientists made during the last 2 months, not so many days. I think the most achievement is that the first is the science. Yes, if we want to control the disease, we have based on science. And the science, I believe that many doctors and researchers, scientists in Wuhan and in other cities of China contributed a lot to the knowledge of the new disease. So everyone have to remember that it's a new disease. If we have a new disease, it takes time for us to get to know the disease. And we get to know the disease for several steps. First step is that the doctors to collect the clinical data, the clinical science, the laboratory findings, and the chest X-ray and the CT scans. This is the first step. And the second step is the pathology. And the good news that the pathologist in Wuhan City has done autopsy. And the pathology data help the clinicians to know more about the disease. And third is the basic science. So it's the first time that the Chinese scientists find the cause of the disease. We look back to the end of December. Nobody knows what the disease is. And because the disease is viral pneumonia with the known cause. But now we have the cause of disease. The disease is caused by a novel coronavirus, and now it's named by the International Society as SARS-CoV-2. And the disease, we call that COVID-19. I think it's the first achievement of the China made during the last 2 months. And second is that is the openness of the Chinese government. From the very beginning, the China government have face-to-face connection with the WHO. And I'm the person, yes, to introduce our clinical findings from the first cohort of the cases. And I also got email from the foreign physicians. They know, and we got to know for many years. They told me that, Cao Bin, I got to know the disease through your publication. And I helped them, for example, I helped the American doctors to publish the first paper in Blue Journal. And in Blue Journal, they introduced to the American citizens what the disease is like. I think it is what we have done during the last 2 months. Thank you.
Okay. Professor Li Haichao, would you like to add some words?
The tasks for our teams is to treat the critical ill patient. So my experience is the following aspect. The first one, we must set up the multiple discipline teams because it's a very severe pneumonia and it can develop to be ARDS. And the severity situation needs multiple discipline doctors to treat the different situations. And the second one is that to keep the oxygen supplement is very important. So the oxygen therapy and the rational use of ventilators is very important. And the third one, I think, just as Professor Cao said, it's a new disease. So in these areas, we set up a mechanism for sharing knowledge and experience between the colleagues from the different areas. So it's very helpful for us to know about this disease. Thank you.
Okay, Professor Du, anything to share with us?
Well, it's a very difficult and tough question for me because there are too many things and too little time to think about it. But however, if I could have the chance to go back, I would say I will try more aggressively the invasive mechanical ventilation in all patients with clinical deterioration in terms of the respiratory failure or hypoxemia. And in addition, I will try more aggressively to propose my suggestion to the local and national healthcare authorities in order to convene all the my ICU colleagues, including the doctors and nurses, to work together in some designated hospitals to establish a intensive care unit to cope with the critical care surge or the surge of the critical ill patients. And I do believe such kind of the measurements of approach can help our patients, especially those critically ill patients, to recover more rapidly. Thank you.
Okay,
Yeah,
want to
actually,
add
this
some
time,
words?
gave
Sure.
us many lessons to learn. Yeah, actually, not only ICU, not only the respiratory tract disease, actually, some patient have the underlying disease complicated, like vascular disease, hypertension, diabetes, and also kidney failure, something. So we need to combine together the specialists to treatment this complicated condition.
Okay, thank you.